everyone. This is JD Faccinetti coming to you from Endo 2025. I'm very pleased to have Dr. Peter Traynor, Senior Vice President for Clinical Endocrinology at Crinetics. Lots of exciting things happening at Crinetics.
Yeah.
And can you tell us a little bit about what you do at Crinetics?
So I'm essentially a clinician who spent 37 years in clinical academia, and now for the last 5 years I've been involved in Crinetics because it's a company created by 4 scientists doing all our own discovery science. And at the stage where we started to enter the clinic and do clinical trials, the company was keen to bring in clinical endocrinology experience, people with a pedigree in doing clinical research. And so I'm involved in engaging with our discovery scientists about our pipeline of products and in working on the details of the clinical trials, the engagement with the centers where patients are treated, overseeing that process, gathering the results, communicating the results with the greater community. And in particular, the bit I enjoy is getting the input of people external to companies, getting critical friends to tell us what we're doing right, but more importantly, to tell us what we could do better. So I think it's a great job. Building on the work of our discovery scientists.
Yeah. So you've been in this field many years, and it's been changing a lot. It's changed a lot in the last 15, 20 years. Where do you see it going?
So it's changing very fast. And the social impact of endocrinology has never been greater. When you look at the incretins, the GLP-1, the GIP drugs, they are having societal impact in a way that nobody would have anticipated a few years ago. And of course, it's just beginning. And we know that there are new agents coming, there will be oral alternatives to injections, and there's lots we have to learn. And what's very obvious is they are potent drugs, but they're not in place of lifestyle changes, they complement lifestyle changes.
Yeah, the facilitated lifestyle changes.
And so, gosh, that's phenomenal. It's not my field. You know, I'm a classic pituitary adrenal type of endocrinologist, but you can't, but when you're at this meeting, not fail to notice the impact that they're having in populations. My area, pituitary adrenal disease, there's improvements in treatment for Cushing's have been slow to come, but now we're again in the era where patients with Cushing's have options for new medical therapies.
And it seems that there's a lot of activity in Cushing's.
A lot of activity, a lot of good things happening. We've obviously got a product that we've now got in advanced clinical studies. We are very encouraged by that data. There is the infrastructure around how you manage patients is developing. In a sense, we've gone from an era, if you think of diabetics, when you had once a day long-acting insulin and it was very difficult to achieve good glycemic control. Once you got better insulins, you get better glycemic control, you get more risk of problems with low sugars. So you have to therefore build all the technology around the sensors and being able to, patient being able to analyze the glucose levels. Well, actually, as we get better drugs in Cushing's, it's the same challenges in that you get better drugs, you have to build the technology to help you assess the efficacy of those drugs. Exciting times.
Yes, very much so.
Acromegaly, there's been therapies, but there's a new wave of therapies coming. And that just increases choice for patients. So, you know, exciting time to be in this industry.
Yeah, very much so. Well, I know that you are a very busy person. You have a full schedule, so I don't want to keep your time, but I really appreciate you joining us.
And we'll talk again.
Absolutely, we always do. Thank you, everybody.